The InTouch Stroke solution includes imaging, documentation, coordination, and analytics modules delivered in a concise workflow on a single platform. For a suspected stroke, EMS radios in a pre-notification to the ED. The ED operator captures data in the Smart Notes module intake section to facilitate rapid triage. A stroke team is ready to respond 24/7, including a remote neurologist. The ED nurse station requests the hospital operator issue a code stroke. The code is issued from a single call activation system, which can be integrated with InTouch Coordinator, so the on-call remote provider is also pre-notified. The stroke team has prepared tools for managing stroke emergencies. The Smart Notes module adds a virtual stroke toolkit with stroke-specific order sets, guidelines, NIH stroke scale, and more. Upon triage and an initial assessment by the stroke team, alteplase is mixed ahead of time. Upon CT acquisition, the user dashboard and coordinator alert the remote provider, who can rapidly begin interpretation of the brain imaging via the InTouch imaging module. As the patient-side stroke team gets results back from the point-of-care lab testing, they are able to simultaneously document via InTouch Smart Notes and enter data into the encounter record with the provider. Once the remote neurologist completes their imaging review, NIHSS, labs review, and understands patient history, they determine the patient is eligible for TPA, and rapid access to the treatment is possible. Via the bidirectional access to Smart Notes, Solo helps facilitate a team-based approach to stroke care, creating reviewable audit trails and clinical narrative for each encounter for later review and process improvements. Following target stroke best practices, the stroke team, including remote neurologists, meets monthly. The team reviews the data and clinical audit trails for each location with the InTouch Analytics module. They review door-to-needle times, alteplase treatment rates, and other stroke performance measures to identify opportunities for improvement. With the InTouch Stroke solution, patients benefit by having greater access to specialists. Stroke hospitals benefit by increasing their alteplase treatment rates, and hub hospitals benefit by receiving more patients eligible for advanced endovascular treatments.